It's an amazing feeling, but above all, it's given meaning to his life and to his suffering. All Mark wanted was that what happened to him wouldn't happen to other people. So apart from the honor of seeing his name above that palliative ward, it's the joy of knowing that his life will have meaning after all, and he won't have died in vain. If we at least help one person, it'll be worth it.
Well, it's been no secret that you've been very critical of the GHA. You said you had to battle for your brother's care. So what have you been doing about this?
Yes, I have been very critical. I've been very, very critical of the GHA because I've spent 2 years talking to people and really understanding, not just to patients, but to nurses, to doctors, people who are afraid to speak out simply because people are worried about their jobs or their pensions or are related to someone who works in the GHA. And I've been very critical because I really believe that if you don't understand the system, you can employ as many people as you want, but you won't fix it. You've got to find the holes and you've got to plug them. And unless you talk to people and truly understand, then there's no real way to make a difference. And yes, I have been critical. Call it negligence, or as the one of the doctors I was dealing with called the situation with my brother, called them lapses in care. My brother suffered immensely. And it really, really struck me when 2 months after my brother died, my father started having a problem with his chest. But because I was involved with the GHA, by then I knew who to call. And my father's still alive, although he had the same cancer as my brother. It made me realize that sometimes it's the lack of the draw and who listens to you in the system. And that's what's really got to change.
Well, I'm getting these quotes from your Facebook page, but you did ask how many people had to suffer or die before there was any change. Do you feel you have made a difference?
I think I've made a small difference. I think the difference that's been made is that people feel now that if you fight and you fight, sometimes ministers will listen. And I have to say that although some of his senior management resisted me and rolled their eyes at me and wouldn't listen because doctors always think they know best, I have to commend the minister and Sandy Gracia and Dr. Keith Gracia and David Santos, the minister's secretary, for having true compassion and for seeing past my grief and understanding that there was a problem that needed to be fixed.
Well, you have an extension to palliative care. What would you say is most needed now? You did highlight access to information.
Absolutely, Christine. I think the next steps now for the GHA are to set up a true patient advocate department, but one that doesn't report to the management, because all managers try and make themselves look good. So why would the management of the GHA be any different? It has to be an independent patient advocate that reports to the minister at the time, that doesn't report to a doctor who wants to cover up his error, so that whoever we vote for to run the GHA has a true picture of what is happening. At the moment, what I've learned over the last 2 years is that sometimes policy decisions are made in isolation. You know, I understand that perhaps there's going to be a change and they're going to remove the current oncology centre for another partner. But if you talk to the population and if you look on Facebook, that's a section of the GHA that really works. And now for some reason, because we've got arguments with stakeholders or for price, we want to change that. If you're going to change it, talk to the people who are using that centre before you do. Because it's our GHA, as Minister Costa said yesterday.